Gentlemen, you are both drunk on cosmic wine.
Welcome to the show. I'm Dr. Mark Sylvester.
And I'm Dr. Richard Schulman. This is Alt Psych.
Welcome to the show. Today, we have a very special guest, Laura Zane, and we're going to be talking about highly sensitive people. So welcome.
Hey, Laura.
Hi, how are you?
Excellent. How did you get into this whole field of highly sensitive people?
So I started out I'm a highly sensitive person myself. I'm also intuitive and empathic. And I started out about 5 years ago with recognizing, I've been a therapist much longer, but recognizing the term highly sensitive person about 5 years ago when I came across Elaine Aron's work. Elaine Aron started researching highly sensitive people in the late 80s, early 90s, and has written several books and has a ton of information on it. And I'm not quite sure how I came across the information, but when I came across it, it was like, oh, there's a name for this. Like she talks about, being super sensitive to smells, picking up little cues in your environment, uh, crying easily, being able to being overly conscientious and being worried about what people think about you on a much deeper level. And her studies are amazing in that they show that it's highly sensitive people are about 20% of the population. So with it being 20% of the population, it's not enough to be considered a disorder, but it's not as common as the other 80%. So people who are highly sensitive often feel like they don't fit in. They feel weird. They feel like misfits. So they're often, they're often struggling even within their own families.
So
Now, you started as a conventional therapist. You're a licensed mental health counselor, right?
Yes.
How did you make the shift from like training, tell me about your mother again, or what are your belief systems into this?
So I think that my belief systems were always kind of, universe gives you that kind of childhood that you need to become the person you're supposed to be and the work that you're supposed to do. And I started out, my parents are not overly religious, but dyslexia runs in my family. So we ended up at a private Christian school because of family stuff. And then on my dad's side, I had my grandmother who comes from Native American traditions. And some of the stuff that she does, I didn't realize somewhere there must have been a shaman in our family. We lost it, but somewhere there was, because some of the stuff that she did naturally and taught me were based in shamanism. But one of the things she did is she read tarot cards, like regular decks of tarot cards. And she did stuff like eating dandelions for medicine. And so there were these two sides of me. The one side that was growing up in my familial household, my nuclear familial household, that wasn't religious, but I was sent to an aunt's every weekend, and we were going to church, and I was going to a Christian school where we had chapel. And then on the other side, we were spending time with my grandmother, who was cooking dandelion roots and making teas and reading tarot cards and doing things that were more esoteric. So as I got older, I started questioning religion because I was one of those people that I would have prophetic dreams. And then I'd go to school and be like, hey, I had this dream last night that, somebody's going to have a baby. Or I had this dream last night that my grandfather's going to die. And they would be like, that's devil worship. And I'm like, but I'm confused. David had prophetic dreams. Why am I so different from David? And they were like, well, David was chosen by God. And I'm like, how do you, 10, 12-year-old self was like, how do you know who is chosen by God and who hasn't been chosen by God? Especially like I'm 10, like, how do you know? And so there was always a lot of questioning in there. And then as I became a teenager, late teens, 19, 20, I ended up with this wonderful psychologist who happened to have a background in psychology, but he also was a theologist. And so coming to terms with a lot of the trauma that happened to my intuitive side, with being told that it was bad, being told it was evil, being told that it was of the devil, and not understanding any of that, but knowing that this is part of who I am and it's part of my truth. Um, so that's, and then moving forward, incorporating the HSP part of it. Like I'm hardwired to pick up these things. It's not just the intuitive, but I'm hardwired.
So does that differ from empaths? Like when I think of highly sensitive, I think of empathic or empaths, but from what I understand, they're not the same.
They're not the same. They're not the same. So highly sensitive people are hardwired differently than the majority of the population. We actually have more mirror neurons in our brain. There's been studies to show that there's more actual mirror neurons. And so what that means is we are picking up the physical cues in the environment in a different way. We're noticing the little nuances that people who are not highly sensitive, the other 80%, don't notice. So we might notice things like somebody squinting and recognize that they need the light change, and we know what to do to change the environment. We might notice things like people have changed their glasses, and they all week long nobody's noticed they changed their glasses, and you walk in, and you're like, oh, that new glasses, huh? And they're like, nobody's noticed. They're not that much different, but we notice the minor nuances. But it's more of a physical thing. Empaths feel the world. So the difference is they're noticing the nuances, but they're noticing the feelings in the world. When they walk in a room, they're picking up the little nuances, but they're picking up the feeling vibration, the energy of the room, whereas HSPs are picking up the physical cues in the room. That being said, I'm going to say all empaths. There haven't been too many studies on this. I'm going to say all empaths are HSPs. There's probably a few exceptions here or there, but I would say all empaths are HSPs. Not all HSPs are empaths. So you can pick up the cues in the world, but not the feelings in the world.
Do you think that women are more likely to be empaths and highly sensitive, or it's just that men don't let it happen?
The studies are showing that men and women, it's equal, that men are just as likely to be as highly sensitive as women. And that's according to Elaine Aron's studies. What they have found is culturally, we don't allow men to own that sensitivity the same way we do women. And so
oh yeah, my father was the most psychic person I ever met in my life, and he would never let it out of the box.
Right, and that's a big issue, because then how they're knowing these things, and let's face it, sometimes being highly sensitive and being plugged in the world, it can be a blessing and a curse all at the same time. And then if you're having to carry that by yourself and not talk about it,
Right.
that can be really, really difficult for anyone, but especially for men who are supposed to be tough and strong. If they cry because of the way we're hardwired, HSPs tend to tear up, or because they can literally put themselves in somebody's shoes. So they tend to be really justice advocates. They tend to be people who are just advocates for the world because they know what it's like.
What you were saying before about the mirror neurons, I find really interesting, and it makes me think it's kind of like a reverse autism.
Yeah, right. Like it is. We pick up. It's almost like a reverse autism. It is. I mean, like that, because there's things that will, like, they may have the sensory stuff, the sensitivity to tags. They may have the sensitivity to lights, the sounds. Sounds for HSPs are huge. Like if you've got like the TV blaring and the radio going and kids screaming, HSPs are going to get really nasty with you because they're overstimulated. So in that way, it's like autism. On the other way, it's like they're so emotionally aware that it varies significantly from autism.
Do you find that you were talking a bit about being, I forgot the word used, maybe being religiously abused because you know about tarot cards, but also if you have this gift of intuition or of empathy, does that play into it too? Do you notice that with your clients?
I see it a lot with my clients, that there's like a religious trauma from being the core of who they are as an intuitive person. Like when you're an intuitive, it's not something you, I don't want to say it's something you necessarily choose, because I believe that we choose our own path before we come down to this planet. Um, but like for many of us, it's just something that's there and you can't explain it. So when you go to the church and you try to talk about this, because let's face it, for me as a 10-year-old kid, knowing that my grandfather was going to die soon, that's really overwhelming. And I go to school and I'm like, oh, my grandpa's going to die soon. I want to go say goodbye. And they're like, what? Is he sick? And I'm like, no, I just had a dream. I know he's going. And they're, then to get criticized for that when the emotion of knowing something's coming and you don't have any control over it, that it's kind of like it can be really, really traumatic. And then being told not only don't you have any control over it, but that you're bad for having it, or that you're wrong, or that the core of who you are is evil. That kind of damage that does. It only leaves you the choice of, do I shut this off to try to fit into something that isn't necessarily who I am, or do I go ahead and embrace this and reject all the things that I've been taught?
Do you teach people how to use it in their lives? I'll tell you, I had a friend who was a fire inspector who was highly intuitive. And what he would do when he'd go out, after there was a fire, he'd talk to his guides and they'd tell him where to look. So he had this incredible hit rate. Finally, his boss, the fire chief, said, well, how are you doing this? And kept badgering me. He said, well, this old woman in Venice who I consult with. It was him.
Oh,
But
right.
then the guy wanted to meet the woman, and he finally fessed up. He said, well, I'm doing it. And he says, oh, get out of here. But he didn't back down, which I thought was great.
Right. Yeah, yes and no. So my intuition is I'm intuitive, but it's more like I feel like I'm getting impressions when I'm on this side. When they come through is otherwise they come through as dreams. And I think that's partly because I keep myself so busy that I'm not very good about completely meditating and opening up. But when I'm sitting there, it's almost like it's an impression. It's like just kind of a thought that's placed in there. And sometimes the thought seems like it's coming out of left field. And then I'll be like, okay, and I'll say the thought and it'll come out and the person just starts bawling. So I know it's not completely, because it's not often related. What I work a lot with my people on is I can give them basics, like you can do things like work on when you're driving through a parking lot, see if you can figure out what lane the parking lot's going to go to and see if you can be pulled to that. Like I can give them some basics, but I don't teach them how to really open their intuitiveness up. What I do, that's not correct. I teach them how to be open to their intuitiveness, but I don't teach them how to be intuitive. That's something that most of my people already come in with, which I think the majority of human beings have. And what I work with them on is how to be open to accepting your impressions and trusting those impressions. So a lot of
Yeah,
people come in.
yeah, I
Yeah, they
get
don't
that.
trust
I
them.
get that a lot too, and I'm often counseling them on how to use it.
Right.
Like,
How to
don't go into McDonald's and tell everybody what their past lives were.
Right, yeah. You don't give information, you don't push information on people, but it's meant as a guidepost for you, and
Right.
trusting that your guideposts are accurate. And the other thing I work a lot with, because I see a lot of empaths, is we work a lot on bubbling and setting energetic boundaries around yourself so that you're not absorbing all of the frequencies. You walk into a store and all of a sudden you're being bombarded with everybody else's energy. And if you're new to being awakened to your empath self, I don't want to say new to being an empath, but new to being awakened to it, you start realizing, oh, this isn't my stuff. Like a lot of empaths come in, they've got depression, they've got anxiety. And when you start tweaking it out, like, okay, if we were to take this person out of the room, is this your anxiety and depression, or are you absorbing other people's anxiety and depression? And when they start practicing with it, they're like, oh, it wasn't mine to begin with. And so then we work on, okay, how do you give that back to the owner and start setting energetic boundaries for yourself? We talk about bubbling, we talk about screaming, we talk about mirroring. So we do a lot of the energetic boundary stuff.
Have you
But
seen more of this since the COVID thing happened? I know that right after it started, I was driving down the street and I had a panic attack. And I said, what the hell is going on? And then it kind of hit me. I was taking on the whole community. And as soon as I had that thought, it went away, but it was pretty profound.
Yeah, what I'm seeing is the people who were struggling with it, they're feeling it deeper. Yeah, the COVID thing is making it like they're feel the COVID for me is part of the awakening process that's happening for our planet. We needed to shut things down, quiet things down, and allow people to really be with themselves in order to have the awakening fully happen across the planet. And at least that's my personal, there's no like science behind it, but that's just my personal thing that I think that's the gift of COVID is it's quieting things down enough. My empaths are having a harder time because they're feeling it. My HSPs are not. My HSPs are like, ah, I was made for this world because 80% of HSPs are also introverts and they are overstimulated. So when they're getting to go out and the world's not overstimulating, when they're being forced to stay home and they don't have to make up excuses as to, oh, I'm on sensory overload. Like they're like, I was made for this world. Now there's 20% of those HSPs that are extroverts that are struggling a little bit. But even the extroverted HSPs are good for maybe 3 or 4 hours. And then they need a long time to recoup from being out. So my HSPs are doing better with the sensory because they're getting fewer sensory overloads. My empaths and my intuitives are feeling the world and freaking out with COVID.
well, one of the things I'm seeing in my practice that I think is really fascinating is, like you said, the separation, the delineation of the HSPs, which has been kind of startling because, I assumed there was a much smaller percent, and I was just missing a lot of them. And COVID, I was shocked how many people actually are, like you said, thriving better in their kind of reduced environment. But HSPs in general, the reason why I love this topic is because there's such a need for these people to not only discover why they are the way that they are and what they're dealing with, but to help remove a lot of the trauma, whether that's religious trauma or marginalization, or worse, a psychiatrist putting them on antipsychotics because they're, sensing energy or spirits. And I worry a little bit sometimes about the language, that it makes sense to intuitive people to think of, like Tesla said, the universe in terms of frequencies and vibrations. But on the other hand, thinking of the autism analogy, if you are trying to explain social cueing to an autistic person, they really do not have the hardware to fundamentally grasp what you're saying, or specifically what the experience of not being autistic is. So by the same rationale, a highly sensitive person is really going to have a disconnect with normal people because they're one standard deviation in the other direction, like an autistic person. And that's why what you do is so important and so critical, because you can meet on the same level, not only educate these people, but have them use their gifts and their skills and their ability to see the world through extra mirror neurons and these more, again, extra sensory type of perceptions, and use it to their advantage. And in every case that I've seen, they're astounded, they're blown away. They learn to, the validity of what they're experiencing.
Yeah, that's the coolest thing is when they learn the validity of what they're experiencing and they're not told anymore that, oh, you're just anxious, go get on meds. Because when they go get on meds, they feel really disconnected. They're like, no, my emotions are my guideposts. And so when they learn how to use that for their strength and validate it's amazing because a lot of them do, not all of them, but a good portion of them do tend to go in helping fields, fields that are more dealing with emotions, they're the helping fields. And so oftentimes they'll get overwhelmed when we talk about, like for me as a therapist, a lot of therapists will see 30 clients a week. If I see 30 clients a week, that might be the considered the norm. I cannot see that. I'm too emotionally engaged in what I'm doing. So I have to cut it down to 20 a week at max. And so recognizing that they may have to do more self-care is huge, And so if we can say, hey, let's not put you on meds. Let's go ahead. And I'm not anti-med by any means. I mean, I think there's a time and place for it. But a lot of highly sensitives are going in and they're working 50, 60 hours a week. They're completely burnt out. And then they're like, well, I need to do something. What they really need to do is work with their system and cut back their hours and do better self-care. And then once they're able to do that, they're able to get through the day-to-day functioning.
It sounds to me like what you're actually doing is opening people up to more self-knowledge about an area that most therapists are not going to even ask about. I remember one of my old girlfriends said to me, "Can't you feel things like everyone else?" I said, "I don't think so. I think I'm wired this way."
Yeah.
And if I was already accepting it, but I think a lot of people would say, "Oh, there's something wrong with me, that I'm wired this way."
And that's it's a huge piece. That's the biggest part of, I mean, I'm meeting, I work a lot with women, but like I said, it's men too, and I'm meeting people in their 50s that are like, I've always felt this way and I didn't feel like I fit in and I didn't have a name for it. Like for me, I cry at a good Hallmark commercial. Like if it's a good Hallmark commercial, I physically put myself in that Hallmark commercial and feel it. And it was always considered weird, My family would joke and tease and make fun of me that, oh, it's a good Hallmark commercial, you're crying. But when you have that over and over again, and you don't realize, oh, it's the way I'm hardwired. This isn't, there's something wrong with me. I'm just hardwired this
You want to play pro basketball, be tall.
way. Right. Like,
You want to be a good therapist, a psychotherapist, have some empathy, have some
right,
sensitivity, right?
right, exactly.
But these people tend to, I mean, they don't ignore, once they kind of know that they're dealing with a different setup, let's say, they don't ignore their intuition or spirituality. It either validates what they've already experienced, or do you see them going on to further develop that, their sense of spirituality or connectedness to the universe, other people,
I think it's both.
tuning in?
Yeah, I think it's both. I think that once they accept it, then they begin to start tuning into it, and it becomes a little bit more of a fun thing. Like, I have a lot of people that would be like, I was feeling this, and I was feeling it from this person. So in the past, they would have ignored it, shut it off, and instead they're playing with it more. They're like, so they ask the person, "Hey, I get the feeling that maybe you've got a headache here," and they're like, yeah, I do. Okay. And then they're starting to use some of their skills and identifying this person's feeling this way, and that's what's causing their headache. So they start to play with their intuition a little bit, and then they start to use it with other people and seeing how they can help the other person. So that, because HSPs are very conscientious, they want to do good things, they want to help the world. So like when they start to recognize that this is a gift they've been given, instead of a curse, that they start to play with it a little bit more. Now some of them, we do have to get through the curse piece of it. They're like, I just don't want to feel the world quite the way it is. I don't want to, this world is too heavy. There's so much going on. There's, COVID, there's politics, there's, all of these things. People are depressed and they're sad. And once we can help them start to block that out and then focus on a higher level vibration, they start to be able to focus on that too. Because if you can tap into the low vibrations, you can also tap into the high vibrations. And so that's part of what we work on with them is,
But you have to clear their trauma first. I mean, these people have trauma in one form or the other, whether that's at school or church or parents.
Not all of them. I mean, if they've come from a family that's accepting of it and doesn't downplay. But if they do have trauma, we have to work on the trauma. And that's a big thing. A lot of people will just say, oh, HSPs have trauma, and that's the way that it's just a trauma reaction. Sometimes, yes, it can be a trauma reaction, and HSPs tend to respond stronger to more minimal traumas. So what what a non-HSP would be able to maybe brush off, may be a very strong trauma for an HSP. So the trauma plays into it, but you can be an HSP and not have any trauma, so, but when we're working, if we're having religious trauma or spiritual trauma, yeah, we have to work through that and get them to the point where they understand that the person who gave them that trauma just didn't understand the perspective they were coming from. And allowing them to feel their anger, their sadness, their frustration, just like they need to grieve that, but then begin to embrace who they are.
This is fascinating stuff. If you think you might be a highly sensitive person, please seek out Laura Zane at Sage Synergy. I could talk all day about this, but the producers are telling. Wait, we don't have producers? All right. But we got
Your next patient is telling you.
But thank you so much for joining us. I hope we can have you back. There's so much here that is fascinating. I think you're going to be much more integral in the future of psychotherapy in the next 50, 100 years. So until then.
You're very delightful. It was really great to talk to you.
Oh, thanks. It was great talking to you too.
All right. We'll do it again. And until then, remember, be well.
Be well. Hey, we got it that time.
No, we blew it.
Well, close. Closer.